Dr. Vala.
Hi,
Why don't you tell me a little about yourself? What's your background, and why are you so passionate about this bariatric program?
my name is Francis Vala. I'm a practicing family physician in North Vancouver, BC, and a bariatrician. That is, a specialist in medical weight loss, management of related metabolic disorders, and prevention of chronic disease. I believe we cannot keep up with the rising demand of healthcare in the aging population, and the only way we can address that is to shift our focus from acute care to preventive care. In the last 30 years, we have been seeing a rising trend in obesity all across the world, not only in Canada and US. Similarly, there has been a trend in the rise of chronic disorders such as diabetes, heart disease, hypertension, stroke, and several types of cancer. There's a lot of science that shows the association between obesity and many of these chronic disorders. I would like to use the analogy of a tree. So if we consider these illnesses, these chronic disorders, as rotten fruits of the same tree, the source of the rotting is not in the fruits, but in fact in the roots. And as a bariatrician, I would like to focus on the roots of these illnesses. And I believe that's the only way we can manage and eliminate or prevent these chronic disorders. On a personal note, both of my parents died to sudden heart attack in their 60s, and that's the reason I'm so passionate about prevention, and I don't want anyone else to go through what I went through.
What is the science behind obesity, and why do so many people have trouble losing weight?
It is believed that the problem of obesity is related to energy imbalance. It's somewhat true, but there's a lot more to that. The problem does start with energy imbalance, but when your energy intake is more than energy expenditure or output, the excess energy is stored in your body, predominantly in the fat cells and liver cells. It's stored in the fat cell or adipocyte as triglycerides. What happens with the enlargement of these fat cells over time, there comes a point where a critical mass is reached, and this healthy fat cell turns into a sick fat cell. This phenomenon is called the sick fat cell syndrome, or adiposopathy. At this point, the fat cells start secreting a number of toxic chemicals in the body, which is distributed to different tissues. Today, there is over 100 of these substances that have been discovered, and only 2 of them are beneficial. The rest of them are toxic and pro-inflammatory. And that explains why obesity and overweightness is directly related to a number of other chronic diseases, such as hypertension, diabetes, cardiovascular disease, and even several types of cancer. In layman's terms, your metabolic system cannot function properly due to these toxic substances, and that explains why most people have difficulty losing the excess fat cells.
How does your program work?
So obesity is a chronic disorder, and it needs to be treated as a chronic disease. In general, there are 2 types of programs: medical programs and non-medical or commercial ones. Our program is a medical one. It consists of 2 phases. The initial phase is acute phase, where we help patients lose a certain percentage of their body fat, mainly focusing on their fat cells, within about 6 months or more. In the second phase, which is even more important, it's called the maintenance phase, and we help patients maintain the lost weight and avoid weight regain. And this phase is a lifelong program. In this program, we use a lot of lifestyle modifications, behavioral interventions, dietary advice, education, exercise, and sometimes we use nutraceuticals, herbal remedies that have been proven and scientifically work. And in certain patients, we may use medications and pharmaceuticals. There is a small number of patients that may be eligible for bariatric surgery. I do not do the surgery myself, but we work with the only bariatric surgeons here in BC to arrange the pre and post-op care.
How is your program different from other weight loss programs?
As you know, many of the existing programs are commercial programs. They're not really medical. Our program, which is a medical one, follows the standard guidelines for the management of obesity and overweightness that is currently being used in Canada, United States, and internationally. It is supervised by a physician based on science and evidence. It is individualized to each client because every patient is different. It is sustainable, and there's a lot of focus on the maintenance phase. We use a number of flexible diets. It is affordable, and it focuses on fat loss as opposed to weight loss.
How do you see the future of our healthcare system?
Well, let me explain the current status of our healthcare system, which truly I think it's more of a sick care system than a healthcare system. The problem is that today most of the focus is on curative medicine as opposed to prevention. And each of these rotten fruits that I discussed earlier is being treated individually and separately in a fragmented style. And we're missing the point that all of these are connected as a system. I believe the only way we can sustain our universal healthcare system and to meet the demands of the aging population is to shift our focus from acute care to prevention. Not to say that we should dismiss acute care, but what I'm saying is we need to allocate more resources towards prevention and education and to treat these chronic diseases all as connected as one system.
Dr. Vala, thank you so much for your time. This was very informative, and I wish you best of luck for the future.
Thank you. It's been a pleasure. I would like to thank my viewers and ask them to be more proactive about their health and well-being. If you have any questions or concerns, please feel free to contact my office or my website, and we have a free consultation. I'll be more than happy to address any concerns or questions you may have.